Well, just as kids get ready to head back to school, the American Academy of Pediatrics is reporting a rise in cases of hand, foot, and mouth disease. There's no treatment or vaccine available, and it's highly contagious. Just what you want to hear as a parent, right? So how can we avoid it? Dr. Annie Mlnarik, a pediatrician with Endeavor Health, is here. Good morning to you, doctor.
Good morning. Thanks so much for having me.
Thanks for being here bright and early. So explain for people who are not aware, what is hand, foot, and mouth disease, and what are the symptoms?
So hand, foot, and mouth is a viral disease. It usually presents with a day or two of mild fever, and then kids can get a rash, often in the palms, soles, around their mouth, also in the diaper area. It should probably be called hand, foot, mouth, and butt disease because we see it there so often as well.
That makes it less desirable, though, even though it's bad enough.
But
yes.
It can last a full week.
It could last a week. Okay. So what is the best way to avoid infection?
And this is the not so great news. There's not a lot you can do besides good hand hygiene, so washing your hands a lot. It's spread via respiratory droplets like a typical cold or contact, or also fecal oral. So if you're changing diapers at a daycare, that's another high risk setting. So many children will have it many times during childhood, but because there's typically no serious complications, it's not something that should be having you on huge alert.
So let's say your child does start developing symptoms. Should you take them to the doctor? And is there any maybe over-the-counter medicines you can get to ease their symptoms?
That's a great question. So typically, run-of-the-mill hand, foot, and mouth doesn't need a visit to the pediatrician. You can give Tylenol and ibuprofen around the clock to help with any pain control because the lesions can be painful. One reason that it would make sense to bring your child in would be if you have a much younger child and because of the lesions in their throat, they're not drinking and they're getting dehydrated. Sometimes we'll see kids for that. Or if your rash just seems to be, out of control, getting a lot worse, we will see you for that too, just to make sure there's no secondary bacterial infection on any of the lesions that were caused by the virus.
I know you mentioned this before, but I'll have you talk about it again. How long does it last and how long is it contagious?
So most kids will have a course about 5 to 7 days, but contagiousness can actually linger for weeks, which is why it's not really an indication to keep you out of daycare because you're still shedding the virus in your stool for even up to a month after having the virus.
So let's say that someone in your child's class comes down with the illness. How soon before your child might start developing symptoms?
Incubation period is pretty quick usually. So within, 2 to 7 days, you would expect that your child might show some symptoms.
Okay, doctor, thank you so much. I hope for parents at home, they don't have to deal with this.
Agreed. Have a great morning.
Thanks, you too.